So Beverly, how are you?
I'm doing very well, thank you.
Beverly Klug is checking in with her doctor after a transaortic valve replacement operation, or TAVR for short.
I was born with a heart murmur, and at birth I had this.
Klug considered having cardiac catheterization after learning about the procedure while in nursing school in Chicago, but safety concerns and pregnancies delayed any action. As she grew older, her heart became more of a concern. Klug elected to undergo open heart surgery, but that too proved to be a temporary fix.
My physician said that my heart was changing and we needed to think about having it repaired. One morning I got up and I was very dizzy.
Klug and her husband rushed to their physician, who soon made arrangements with Strong Memorial Hospital to have a pacemaker surgically implanted within her. Her physician also referred her to the TAVR team at URMC. After meeting the cardiologists and surgeons, she received her operation in December 2015. Right away, Klug was able to feel the difference.
My blood pressure was good, everything went along smoothly.
URMC marked a milestone earlier this year when it completed its 200th TAVR operation. URMC's Medicine Heart Valve Center introduced TAVR to the area in 2012. Although as one of the doctors involved with the procedure knows, it's had quite a history before coming to Rochester.
TAVR for short, was developed. It was actually first done in France in 2002. It actually was FDA approved in 2011 because of a study that showed that it was of benefit in people who were too risky for surgery. So there was a study done where half the patients got traditional open heart surgery, half of them got this TAVR, and the TAVR patients did just as well as the people who were high risk for surgery.
According to Dr. Ling, URMC was one of the first hospitals to gain access to this technique after approval by the FDA. By using a catheter with a balloon on the end, a small metallic ring, called a stent, is inserted into the heart valve, creating a more open artery to allow blood to pass through. While the procedure varies in its point of entry, Dr. Ling doesn't find it too invasive, with a typically short recovery time.
A lot of our patients, for example, they come in, they have the procedure, and they're home within a day or two after the procedure, while with surgery, sometimes 5, 6, 7, up to even 10 days after surgery is required, and then they need to recuperate even longer after that because of healing their chest incision.
Another individual who needed the TAVR procedure was Jane Watkin. Before her operation in August 2015, she had multiple limitations due to her condition.
It limited me, and I couldn't sing, and I couldn't walk for any great distance, and I'd get tired. Most of anything that I did. Any procedure, any activity that I did.
Now, however, thanks to TAVR, Watkin has plenty of energy to keep doing what she loves, singing in the choir without needing a break. Patrick Harney, Innovation Trail.